Thank you. I'll just press forward. So as introduction, can you press that? I just would like to show you how this leprosy mite is going to work. Usually, the mite of leprosy, for a dermatologist, just to it burrows around 2 millimeter in the skin, and it lays eggs there, and usually one mite lays 20 to 30 eggs, and then follows the burrows. And this is clinically important in the clinical diagnosis of leprosy and, scabies. Yeah, because I was impressed by the leprosy presentation, that's why. And the other thing is, most of the time, what's clinically important thing is that the itching from leprosy from scabies usually comes not because of the mites, but because of the immunologic reaction. So in general, the transmission of scabies is just the prolonged skin-to-skin contact, and most of this skin-to-skin contact is household, but in most developing countries also, school-based transmission is very common, especially in our setting. We see that children sitting in one bench, 4 to 5 children, and most of the time it needs around 15 minutes and more skin-to-skin contact. And the other is just sexual, and overcrowding is one of the risk factor. And the old saying about fomites as one of the factor for transmission of scabies, and most of the research are showing actually, except in crusted scabies, in the classic scabies, fomite transmission is unlikely. And so scabies cause significant health impact, and it can be grouped as 3. The clinical symptoms usually as itch, and the itch, when you see those pictures, it's so severe. Most of the time, those kids, they may not have sleep, especially moms with small kids. The child is crying overnight and not really adequately breastfeeding. And in addition to that, it has stigmatization, and plus also it can give you the super infection, and that super infection can lead to a serious either secondary immunologic sequelae like chronic rheumatic heart disease and also renal failure. Someone is sleeping there. Okay. So as you can see, this is the picture of some of our patients from the last 4 years. It can present as simple in children's. Usually, it can affect the whole body. In adult, mostly scabies. In 80% of scabies patients, commonly you can diagnose scabies just by looking their hand. And in young children, you can diagnose scabies just by looking their genital. But one thing we have found a difference in our setting, especially, is in adults, scabies affect the private area, And And the other thing is the psychosocial complication of scabies. And I would like to mention some of our studies especially in poor countries. Patients' treatment, they come really very late, and even when they come for treatment to the hospital, they may not get the treatment because the drug was not available. And in average, in our clinic, what we have found is actually it takes them around 5 months to get to the treatments. And 42% of our patients have severe illness, severe categorized as lack of sleep and additional bacterial infection. And in 75% of those patients have a severe illness and, case have another family members which has been affected. And the most important thing was 5% of our children, they are skill dropouts. So we actually, to sell it for the politician, what we did was we calculated how many children were absentees from school. And in a country whereby you have really difficulty to push kids to come to school, when you have 100,000 in one district population, around 30% of those 100,000 are kids going to school. It means it's just around 1,000 children are skill dropouts. And so the most important thing about the scabies is when you think of the global prevalence, we don't have much data. There are some data which is coming now from the Solomon Island and around there. But globally, the quality of data we have is a bit of weak, and especially in Africa, if you see for the last 5 to 6 years, we have limited data from East Africa and North Africa, but most of the African countries, they don't have even the data. So, and the other important thing is, especially when it comes to scabies, for standardization of the diagnosis of scabies, the IACS has tried to standardize the diagnosis of scabies with developing consensus criteria. The first consensus criteria was developed in 2018, and the second consensus criteria was developed in 2020. And this is a clinical diagnostic criteria. As you can see, you can diagnose scabies either confirmatory cases or clinical suspects or clinical scabies. But for the issue is the confirmed case is just the bacteriological or microscopically confirmed cases. As you can see here, the sensitivity, the specificity is high, but the sensitivity is very low. And the issue here is, especially for as a dermatologist, you have to know this, that bacteriological or microscopic diagnosis of scabies is very much complicated because, as I have said it first, the area which is itching is not the site of the mite, may not be the site of the mite. It's usually from immunologic reaction. So the sensitivity of microscopic diagnosis is less than 30% actually. So we have to really rely on the clinical criteria. And one thing I would like to talk on this clinical criteria is actually on the specific clinical manifestation, the boro. The skin boro, in 2019, actually we have discussed it with the WHO also. Yes, you can see the skin boro. Still, IACS has included the skin boro as one of the specific clinical diagnostic criteria, but as a dermatologist working in Africa, it's just most of our patients, you don't see the skin boros. You don't see the skin boros, and that's the one thing. So the control strategies, I'm going to talk 2 of the control strategies. The first is in the intensified case management, and the most important thing here is the drugs and the availability of the drugs. And the topical drugs, the most effective drug from most of the review is perimetrin, followed by benzoic acid, and for young kids, sulfur, But one of the new developments, especially which has come in the last 5 years, is ivermectin systemic treatment, which can be useful for individual management, but most importantly for community-based management. And in individual disease management, contact tracing and contact treatment are the instrument to control the disease in lower prevalence area. And for the community-based management, this is just, as you know, in the last 5 years, we have a shift from this specific program to integrated management strategy for skin NTDs. And the most important thing is to integrate scabies into the other skin NTDs and also other NTDs. And for this, IACS and WHO, we are working on the mass drug administration and the standardization of the mass drug administration for scabies. The first mass drug administration in non-island community was done in Ethiopia. Actually, we have administered 3 times mass drug administration for scabies in one of the community. First, it was for 1.2 million people. Then we have screened around 10 million people, and we have administered mass drug administration for around 1.8 million people. And the impact assessment has shown that actually, if there is a follow-up, ivermectin-based treatment for community-based outbreak is effective. And from the global policy, WHO has included ivermectin as one of the essential drugs. That's the most important message here. And there are now already one licensed pharmaceutical company who is willing to provide ivermectin with minimum price. And this is the 2019 IACS working with the WHO to develop the WHO informal consensus on framework for scabies control. And in this journal, or in this guideline, we have actually included what are the gaps from the diagnosis, mapping, and community-based management for scabies control. And so the key recommendation is, while MDA were estimated community prevalence greater than 10, there will be an MDA administration, especially for 2 to 3 times, and 2 treatment of ivermectin within 7 to 40 days apart. There is, I'm going to jump into the last slide. There is a very standardized clinical trial going on in the Fuji World Scabies program. And in this program, they are actually translating research into scabies control into global public health action. And I think that's all I have. Because of time, I will stop there. Thank you.